Hi, I was interested in your piece about ivermectin as a treatment for COVID. I've been looking at
as a potential, and I should say, of course, a potential treatment, because it's
potential treatment.
Indeed,
yes, indeed. I met Dr. Tess Lowry, who runs the evidence-based medical consultancy in Bath, and she's been doing international studies for over a year now on the use of ivermectin for early treatment of COVID.
Yes.
And she's put me in touch with a number of places around the world who are already successfully using ivermectin. A recently published paper from Brazil has just shown dramatic impact of reduced hospitalization and deaths by the use of ivermectin.
Yeah, I haven't seen that one, but I'm aware of the work that Tess Lowry has been doing on this for over a year now.
But it's interesting that ivermectin is on the World Health Organization's list of essential drugs. And so I find it fascinating that its original creators, who no longer hold the patent, have suddenly declared that it's unsafe when it has probably the best safety record of any drug available on the market.
Well, this was the strange thing, absolutely, Paul, and that's what surprised me, was that it's one thing to say that they haven't seen any evidence that convinces them that it works. What I couldn't understand is why then, as the founder of it, they won a Nobel Peace Prize, why they didn't do the logical next step, which was to say, well, it's beholden on us, really, to do the research, to resolve this one way or the other, and I just, that's where I asked the big question, when at the same time they're investing hundreds of millions of dollars in what became known as molnupiravir, and that's my big question to them. And I have actually asked representatives from Merck to come on the show to talk about it, and surprise, surprise, Paul, they haven't taken up my kind invitation.
Well, perhaps it's because any pharmaceutical company in the world, mainly in India, can manufacture ivermectin for 7 US cents a tablet.
Well, it may well be that, and in a sense, that's the big question. But regardless of the cost, given the chaos, the deaths, the suffering, the agony, I would have thought that the responsible thing to do is to, in a sense, to rush through those clinical trials in the same way that other trials have been accelerated and properly funded, which is all well and good. But why haven't they done what I think was the right thing? I don't know how long their co-founder, the Kittisoto University, have been carrying out their laboratory research and their clinical trials that are ongoing. But I do think it's a very interesting time. I just think the whole thing has taken too much time.
Well, there's a group of doctors, frontline doctors in the States, the Frontline Critical Care, COVID Critical Care Alliance, the FLCCC. They've been really struggling to get ivermectin, which they use as a standard protocol in America successfully for early treatment. They've been really struggling to get any support for their use of it.
They have. It's one of those things throughout this crisis. Those of us, some of us got sort of smeared and attacked for talking about Brexit, and then we got smeared and attacked and called killers for wanting to talk about things like the Great Barrington Declaration and to challenge the whole concept of lockdowns. And likewise, anybody who wants to talk about ivermectin also seems to be smeared and attacked as promoting horse dewormers. And I just think that we need more debate, not less debate, and we need more tolerance and respect for different points of view.
Absolutely. It seems we're not allowed to have any good scientific discussion about other treatments, particularly when there's available treatments
Paul,
already there.
The great thing is, here on Talk Radio, we're able to talk about these things, we're able to discuss them. I'm not sure you're a scientist, I'm not a scientist. I'm saying, as per the WHO advice, the results so far are inconclusive. There are people who believe it works, people who believe it doesn't, but there are more trials ongoing, and I do think it's going to be fascinating to watch this space as we get the results, hopefully from Oxford Principal Trial and from Kittisoto University. I do think it would be very embarrassing if it worked. Paul, thank you so much for those thoughts.